Hey students, it's the second part of our video lesson on depression and suicide. This second part is specifically about suicide. What do we need to know and why it's important to know these things? It's a very difficult discussion, but we need to not be afraid to talk about it because that's the best way we can educate ourselves and help educate others and be able to do something. Suicide's preventable. And the more we know, the better. So, what do we need to know? Let's start by looking at some facts. Suicide is the second leading cause of death in your age group. Okay. So, it's very real. More reasons why we should have it be a part of our conversation. People with depression, who are most likely the people who complete a suicide, believe that suicide's the only way out of the pain of the depression. So, really, they are feeling as though it's the only way out. They can't bear the pain anymore. It's very fuzzy, it's very confusing to be severely depressed, and they are not thinking clearly. 95% of people who die by suicide have a diagnosable brain illness. So they have depression, bipolar, schizophrenia. People who die by suicide are most often people who can be treated. And it's probably that they're not being treated because it's not diagnosed yet, nobody noticed the symptoms, etc. Number one cause of suicide. Think about what it might be. It's kind of a trick question. Number one cause of suicide, untreated depression or misdiagnosed or not treated depression. Okay, so you're thinking, well, I don't understand this. Your brain does get pretty messed up if you suffer from a mental illness. But why suicide? Why would somebody consider taking their own life? How could it possibly be better to not be alive? Well, here are some thoughts on that. First of all, depression causes distorted thoughts and perceptions. So, what a mentally healthy person might think is completely logical isn't the same way that somebody who is suffering from a mental illness might feel. Secondly, depression causes disordered thoughts and perceptions. That person is not thinking right. Oh, sorry, that was firstly. Secondly, they think of it as the only way out of the pain. And it hurts to suffer from depression. Maybe no one recognized the symptoms of depression or saw the suicidal warning signs. It's possible the person has a mental illness that they've covered up, not diagnosed, not treated. Remember, suicide is preventable. So, what are the warning signs? Well, let's start with things people talk about. People might talk about if they're considering suicide or thinking about suicide, they might think about or talk about killing themselves. Most people who are considering this talk about it. They may say, oh, doesn't matter. I'm not going to be around next week anyway. So they'll say things to indicate that they have a plan. Feeling hopeless. They might talk about having no reason to live. They might talk about being a burden to other people and feeling guilty if they're inconveniencing close friends or family. Feeling trapped. It's a very overwhelming, painful feeling to have depression, especially a depression severe enough to consider suicide. And again, the pain. Just as much as if you broke your arm and it hurts, people with depression are in pain. So if they talk about these things, it might in fact be a warning sign. If they have these behaviors, it might be a signal that there is a risk of suicide. Increased alcohol or drug use. Now remember, this isn't isolated events. It's always a combination. Pardon me, a combination of events over a period of time. Looking for a way to end their lives, maybe Googling it online and telling you that they heard that it only takes X number of minutes to be in your running car in the garage before you pass out. Knowing things like that and saying things like that. They may withdraw from activities. They may start to isolate and not talk about what they're doing or who they're with. They just spend a lot of time alone. Again, with the sleeping habits, eating and sleeping are often affected by mental health. Maybe, and this is when it may be what we call imminent, meaning the person has a plan. If they have a plan, they may go to loved ones, visit or call them to say goodbye, to kind of make amends, to make sure that they're in a good place with that person. This might also include giving away prized possessions, something that's very special to that person. They may get super aggressive and then fatigue, again, that exhaustion deep in the bones of just being tired. So these are some warning signs of suicide. So what can you do? How can you help? Well, again, know the warning signs of suicide and the symptoms of depression. Be educated. That's the best thing you can do. Secondly, listen, listen, listen. Talked about this with the depression too. Be there, listen, show empathy. Keep in mind, if someone is considering suicide, their perceptions are not healthy. Their perceptions and their thinking is not clear. Sometimes it's not a bad idea to ask for a promise or a contract. Okay. Maybe have a signal or something to say, hey, if you just text me the pineapple, I know that that means you're struggling and you need me to come to you. You don't have to explain it on the text or nothing. Just send me the pineapple and I know you need me. Okay. That's kind of a promise or a contract. And maybe you need to make sure you stay with that person. Do not keep the secret. If they express any of these warning signs by talking or behavior in a way that makes you nervous or makes you concerned, don't keep the secret. This is not playing around. You don't want to keep it a secret and then have your friend end their life. It's better for your friend to be mad at you than your friend to be dead. Don't keep a secret when it comes to mental health. Remember, talking about suicide doesn't plant the idea. So saying to that person, I'm really concerned about you. You're doing these things and you're saying these things. Are you thinking about hurting yourself? That's not going to plant the idea, but it will help them talk. Have you ever thought of hurting yourself? Ask the question. Have resources. There's a link here to SAVE, Suicide Awareness, Voices of Education, and Teens Health has some good resources as well. And most importantly, the most important thing about helping someone who may be suicidal is to tell an adult. Tell an adult. Remember, just because you don't understand that person's feelings or perception doesn't mean that those perceptions aren't real for him or her. Okay, they might be saying things that don't make any sense to you. That is their perceptions. Remember, their brain is not working okay. So their perceptions are very real to them. And their perceptions are probably a result of their mental illness. Remember, depression is a common and treatable disease. And depression is not about being weak or wimpy. It is an illness. We don't tell people, oh, come on, just get up and get out of bed. Just like we don't tell people with broken arms to go ahead and come on, you can do a push-up. And there's help. Tell an adult at Armstrong, maybe you're connecting and you trust a counselor or a social worker, a principal, an advocate, a coach, school psychologist. There's so many people here at Armstrong to help give support for mental health. Please reach out to those people if you've got any questions. All right. That is the end of our second part of our 3-part depression and suicide video lesson.